Imagine getting surgery that relieved chronic back, neck, and leg pain, followed by a speedy recovery. Sounds nice, right? Well, the future of surgery is here with Excelsius GPS, and Rhode Island now has it. Here to tell us all about this new robot is Dr. Ian Madam of South County Hospital. Good morning, doctor.
Good morning. Thank you for having me.
Thanks for joining us. We are hearing a lot more about these robotic instruments being used in places like doctors' offices or hospitals. Why are they so beneficial?
So the main thing to think about with robotics is that it's not a robot doing your surgery, but it's an additional tool that helps your surgeon or your physician perform their job better. I think of the spine robot as similar to a GPS. I don't get into my car and drive up here to Providence without putting the address in. I know how to get to Providence, but it helps me get there more effectively, safer, faster. That's the same thing that we're doing with robotics. So we're able to leverage the technology, potentially offer people surgery that's less invasive, allows them to recover faster, but we're still doing the surgery.
Absolutely, and maybe what you're getting into is so precise or so minute that you need something like a robotic hand or mechanism to get at it, like you said, without making either like a bigger laceration or something along those lines.
Absolutely. So for spine surgery, we're using preoperative scans, CAT scans, to take and plan exactly where instrumentation or the screws, when we have to do a fusion type surgery, is to place those screws in a precise manner. It allows us to leverage that instrumentation and use it to its greatest potential. For 10 years, I've been doing this without a robot, so we are all trained in how to do that safely, but we can always be better. We can always do a better job to allow the patient to get a better outcome.
Absolutely. And in Rhode Island, I was reading, were we the first state to have something like this?
So we're not the first state. It's actually something that's been out for about a year, but we're the first at South County Hospital in Orthopedics, Rhode Island. We're the first people to be doing this in the state.
Beautiful.
You're going to start seeing it become more popular. I think that us having the advantage of offering this to patients allows us to learn where it's effective, which patients it may not be appropriate for. And there's newer aspects of the robotic platform that are coming up that will go beyond just placing the instrumentation for fusion, so that people who are not having a fusion surgery, we're just taking pressure off of nerves, will be able to use it there as well in the future.
So because you have this new technology, will that mean the recovery process could be shorter for some people, easier, because maybe you're not being as invasive as you would have to be otherwise?
Absolutely. I'm already seeing that. In my early patients, they're leaving a day after surgery, after a fusion surgery.
Whoa. For something like a spine?
For a spine surgery. So
we
do their surgery in the morning, they're up on the admitted inpatient floor, and they start working with physical therapy by that afternoon, walking around.
Wow.
By the next morning, they're saying, you know, when can my ride come pick me up? I'm ready to go.
That's awesome.
That's a really powerful tool. That's not everybody, and I think that it depends on the extent of the surgery, but our more common surgeries for arthritic conditions, that is certainly the case that we're going to be seeing.
And that's what we want. We want everyone to heal quickly and appropriately. Doctor, thank you so much for coming in.
Thanks for having me. It was fun.
I'm happy to hear that you have this new technology. If you want more information on South County Hospital and more on Excelsius GPS, you can head on over to rhodeshow.com.